The health emergency disaster due to the spread of the novel Wuhan coronavirus, also known as COVID-19, is a type of influenza, and it continues to bring challenges and new forms of communicating, ways of doing business or not, and general altered living conditions, as a stay-at-home order means that everyone's life has changed this spring. DCTV Daily News and partners continue to work diligently to bring you the latest information and how this impacts you, the community. Wash your hands, stay well and strong. I'm Kendra Cook, your host for the DCTV Daily News program out of Dove Creek, Colorado. The Dolores County Broadcasting Network is the producer of DCTV with support from the Southwest Colorado TV Translator Association. That's the Special District Association responsible for bringing the area free-to-access TV stations over the air by antenna. This is a community TV station. If there's a news story or event information that you would like to share, you can call us at 970-677-4119. And if you're a business or organization, we welcome you to find out about sponsorship opportunities for banners or video segments run on the channel. This is the Thursday program for April 23rd, 2020. DCTV Daily News. From the Colorado Sun and the Journal, extending Colorado's statewide stay-at-home order, which expires on Sunday, would have a negligible effect on the state's ability to control and handle spread of the new coronavirus. That's what Governor Jared Polis said on Wednesday. Polis said modeling from the University of Colorado School of Public Health shows that the peak health care need would be pushed back if the order were elongated, but the number of patients needing care would not really be minimized. Quote, it inflicts very severe economic pain on people in exchange for really no reduction in the number of intensive care unit beds that we need at the peak of the crisis, Polis told reporters during a briefing at the governor's mansion in Denver. The stay-at-home order will expire on Sunday, and the state on Monday will enter what Polis calls a, quote, safer at home period, during which people should still limit their time in public as much as possible. Offices will open to half of their workers, though telecommuting is urged for as many as possible. Restaurants and bars will remain closed to in-person dining, but retail stores will be allowed to do curbside pickup. People are still urged to interact only with people in their households. Polis announced that coronavirus deaths in Colorado have passed 500 and confirmed cases are now over 10,800. Health officials have warned that there are likely as many as 75,000 people who are actually infected but who have not been tested for the virus. Polis said 150,000 tests for COVID-19, the disease caused by the coronavirus, are expected to be in Colorado by the end of this week. The governor, who has promised for weeks that Colorado has been working to ramp up its testing and tracing apparatus, cast doubt on the ability of testing alone to make a big difference in the state's ability to slow down coronavirus spread. Quote, it's not a panacea, he said. It doesn't solve this. He said the state is still working to expand testing, but that it must happen alongside aggressive social distancing, mask wearing, and the protection of vulnerable populations. Here in Dolores County, the commissioners held a workshop on this topic of how reopening into Phase 2 of the COVID-19 emergency plan would look for our county. The emergency manager and the health director should be releasing an official statement shortly. Right now, we are carefully moving from the stay-at-home to safer-at-home phase on Monday, and for businesses, that depends on what type of business, but certain restrictions will still be in place, such as wearing masks and keeping limited interactions and 6 feet of distancing. We will bring you more as things develop. And now let's take a look at the local weather. The weekend is heating up as we head out of the stay-at-home phase. Today, mostly sunny with a high near 62 degrees, but it will be breezy with a northwest wind at 10 to 20 miles an hour. Be careful if you're trying to spray for weeds out there. Tonight, mostly clear with a low around 34, remaining breezy and a north wind at 10 to 20 miles an hour. A repeat basically for Friday with sunny skies and a high near 61 degrees with north-northwest winds still around 10 to 15 miles an hour. Friday night, mostly clear and a low around 36. And then those north winds, 5 to 10 miles an hour, could be gusty to 20 miles an hour. The weekend is when we really start to warm up. Saturday sunny and a high near 67, with north winds light around 5 miles an hour, becoming west-northwest in the afternoon. But it could be gusty at times to 20 miles an hour. Then for Saturday night, mostly cloudy and a low around 43. And really warmer for Sunday, mostly sunny with a high near 75 degrees. Sunday night, partly cloudy and a low around 45. April 27th is the next Monday, the first day of moving from Colorado's stay-at-home order down to safer-at-home suggestions for those with most vulnerable conditions. It will be heating up, which at one point we were told it's good to kill viruses when it's hotter, which is why the end of April usually is considered the end of the flu season. So look for full sunshine and a high near 77 degrees on Monday. Monday night, clear mostly with a low around 47 degrees. The goldfish in the outside pond at my place are starting to emerge and feed as those overnight temps start to move up consistently above freezing. For Tuesday, looking again for a sunny day with a high near 78 degrees, and Tuesday night mostly clear with a low around 47. And now, back to the news. The Dolores County Sheriff's Office released a letter to the county residents. In speaking with the county commissioners about banning all fires, they came to the same understanding that we as a county are an agricultural area with a need for farmers to clear areas by burns so they can appropriately grow their crops. However, the sheriff states that, quote, "We need to be smart about what we do in our area and keep everyone safe, which includes our first responders. We need to be sure we are making responsible choices when burning." The letter goes on to state that under Colorado Revised Statute CRS 18-4-105, fourth-degree arson could be charged if the controlled burn becomes an issue where the Dove Creek Volunteer Fire Department has to be called to extinguish the fire. If we do not make sure that it is safe to burn, we will have no alternative other than putting a fire ban in place for our entire county. If you feel you have a need for firefighter help in keeping the controlled burn where you want it, then call the Sheriff's Office, and we will then call the Fire Chief Jake Klein or Fire Chief Jeff Yoder to have them schedule a time with you for the fire department to use the burn as a training exercise. The Dolores County Sheriff's Office is still asking you call to the office when you decide to have a controlled burn. The reason for this is so our dispatchers can send the appropriate help to the correct location quicker as needed. Sheriff Don Wilson concludes the letter by stating, quote, "Let's all make a conscious decision to burn smart and continue to keep our community and our public lands safe." So with all of the fear and panic over an unseen virus and the sword of Damocles held over everyone's head that we must not overrun our hospitals and caregivers to make way for COVID-19 patients, meanwhile, there have been reports across the nation of people dying at home from causes that could have been treated, but people have been told to stay at home and stay away from medical facilities, or they just fear catching the COVID-19 disease as a worse alternative to their immediate physical ailments. So now that we will shortly be seeing hospitals and dental facilities being allowed to treat a broader range of patients as the crisis level potential is showing itself, and fortunately, to not be as horrific as was predicted, what does that mean for doctor visits and medical care? The Durango Herald published an article entitled, "How Has Primary Care Shifted During COVID-19 Pandemic?" It states that allergy shots delivered in your car, telemedicine calls with your doctor, and physical therapy via video chat, primary care doctors and specialists are getting creative during the coronavirus pandemic to ensure patients receive care while following physical distancing protocols. Dr. W. Donald Cook, with allergy and asthma specialists in Durango, started implementing a drive-up system around March 22nd to ensure patients receive their necessary allergy maintenance shots. Using 2 parking spots the city allocated to the clinic's drive-up system, patients will park, text the clinic, and staff will draw the necessary shot and deliver it to the patient waiting outside in their car. Cook estimated his clinic provided about 70 allergy shots last week, about average for this time of year pre-coronavirus. With the new drive-up model, Cook said he has not experienced a drop-off in the number of allergy shots provided. But other parts of his clinic have been hit harder, he said. The biggest challenge for Cook and his clinic was the decision not to see new patients. While he's able to provide shots and telemedicine services to established patients, he decided to close the office to limit the possible spread of the virus. With a closed office, it's not possible to intake new patients and do a skin allergy test, he said. Quote, "Until we can start seeing new patients, money will be a concern, he said. Although Cook said he applied for the Federal Paycheck Protection Program loan, the PPP, the funds ran out before his application was processed, but he said he has not had to cut his staff of 4 so far. Primary care providers have also had to make adjustments to how they provide care, with many of them transitioning services to telemedicine. The primary care providers with Southwest Medical Group in Cortez switched from 0 services provided via telemedicine to almost exclusively offering the remote service in the span of 4 days, said Carrie White Singleton, Chief Operating Officer for Southwest Medical Group. By the way, at 4 o'clock every day during the week, they have a live stream on Facebook that you can check in and ask questions, and they'll answer them right there online. She estimated about 90% of the primary care offices have switched to telemedicine, and about 45% of the specialty clinics, such as orthopedic surgery, have switched away from in-person services. With its telemedicine, Southwest Medical Group offers both video appointments through a secure app or phone call appointments for those unable to video chat, White Singleton said. White Singleton also said the primary care physicians have the authority to decide which patients to see in person for emergency care situations. Southwest Medical Group has also established a well lab for those without COVID-19 symptoms who need to get lab results. Patients stay in their cars, and a lab technician in full personal protective equipment as an extra precaution comes out to draw blood. Some specialist providers, such as physical therapists, have switched completely to telemedicine, but not without repercussions to business. Although physical therapy was deemed one of the essential businesses, Mike and Amy Testa, owners of Advantage Physical Therapy and Wellness in Durango, ultimately decided to close its in-person services. Quote, "It was a very hard decision," Mike said, of deciding to close the office and switch to telemedicine services. "It's pretty hard to watch your business go from doing very well to almost no production." The transition to video services was fairly seamless, and the clinic continues to accept new patients, the Testas said. But they have seen a drop in the number of clients and in revenue. Although they are thankful to have received assistance from the Federal Paycheck Protection Program, the Testas said there is still a lot of uncertainty as the public health situation changes so often. At the recommendation of their professional associations, many eye care and dentistry offices in both Colorado and New Mexico are closed except for emergency or urgent needs. On March 18th, the American Academy of Ophthalmology issued a recommendation that practitioners see only urgent and emergency patients, and by the next week, the Four Corners Eye Clinic in Durango had adjusted its staffing and operating procedures, said Marianne Sloan. In addition to seeing only urgent care patients, Sloan said the eye clinic has also split its staff and doctors into 2 groups with alternating weekly schedules. Pod A will work a week and then be off for the next week, while Pod B works. With the week on and week off model, we always have a group of people that is unexposed, Sloan said. Sloan said the eye clinic is probably seeing 10 to 20% of the number of patients it would normally see. With a decrease in patients, she added the clinic was lucky to receive one of the Paycheck Protection Program loans. Quote, "They're getting 100% of their normal wage, even though they're working half-time," Sloan said. The program has made the difference between being able to keep employees. Many of the doctors and healthcare providers in the area said they are balancing providing care to their patients, maintaining a business, and following best practices to minimize the spread of COVID-19. All medical offices are really trying to make sure they don't put any patient at risk, but there's people they have to see, Sloan said. It's a hard thing to juggle, but everyone is keeping everyone's safety in mind. And today's High Canyon Country happenings. Here in Dove Creek, if you are in need of food, The Rock, under the name CUP, Community United Program, is distributing boxes of food to residences with proof of residency in the drive-through manner at the Rock Building on Highway 491. It starts at 3 p.m. on Friday, April 24th. Please remain in your vehicle, and there is no need to show need, just show up. Thank you to all who are helping to bring food into our community. For many, there have been no paychecks and no PPP or government funding, so this is a critical component of keeping our community healthy and fed. And a notice that the Special District Ambulance Board election will be held on Tuesday, May 5th. That runs from 7 a.m. to 7 p.m. You can drive up or walk up to the Public Service Center. That's located at 8477 Road 7.7 in Dove Creek. You elect 2 new board members out of a field of 5 candidates. To request an absentee ballot, please contact Alan Anderson at 970-677-2282. The candidates in the order they will appear on the ballot are Todd Parisi, Linda Raymert, Athena Boyd, Joyce Barnett, Margaret Webb. And for the state update on COVID-19 statistics from the state offices, as of April 22nd at 4 p.m., there were 10,878 apparent declared cases, with 2,123 people hospitalized. It is holding at having at least 1 case in 56 of the 64 counties in the state. Dolores County remains with 0 cases counted. They indicated that with lots of asterisks that 50,645 people have been tested. And we will bring you an interesting article on what is being tested and how, as that is such a key element to making decisions moving forward, actually knowing correctly what is happening with diseases during a pandemic. Here in our county, we are still not testing anyone, as no one has demonstrated a need due to symptoms. And of course, it is sad to report any and all deaths. The state shows 508 people who have died that have been categorized as it being related to or having the genetic markers of COVID-19. And again, a 2020 census reminder. Join the U.S. Census Bureau, the state of Colorado, the city and county of Denver, and more for their first virtual census dance party featuring DJ Chons. It's a census dance party with DJ Chons on Friday, April 24th from 12 to 1 p.m. on Facebook. Go on Facebook to DJCHONZ. It's also posted on DCTV Daily News already. The 2020 census allocates more than $675 billion to our communities for resources like roads, hospitals, and schools, and programs like Medicare, low-income housing, and the federal Pell Grants. The census also translates to political power as we use census data for redistricting and allocating seats in Congress. The census is so vital to our community, and we only do it once every 10 years. To learn more and fill out your census, go to 2020census.gov. To encourage folks to fill out their 2020 census, the virtual dance party will be held tomorrow at noon again, I'll remind you. Tune in to listen to some great music with music legend DJ Chons. He was born and raised in Denver and has been DJing for over 20 years. He has worked with hip-hop luminaries such as Dr. Dre, Eminem, The Roots, and more. You may recognize him from KS 107.5, that must be a Denver station, where he was a staple DJ and personality for several years. Join him on the Facebook page at 12 noon on Friday to listen to some great tunes, fill out your census, and dance like no one's watching, especially if you're not in front of your camera. And I post up all of these High Canyon country happenings on our Facebook page, which is DCTV Daily News, where you can also watch the program replay along with the news links and stories of local interest. And you too can share other events or news there and join in on the conversation. It's your local community TV station. So if you have something you'd like to share, contact us. The email is dcbnnews@gmail.com, or you can call us and leave a message at 970-677-4119. Thank you for tuning in to DCTV Daily News. Programs are broadcast Monday through Friday with replays online on our YouTube channel or on our DCTV Daily News page on Facebook. And if you do like the program, please like and follow us on Facebook and share it with your friends and family. This has been a production of DCTV for the DCTV Daily News program out of Dove Creek, Colorado, USA. I'm Kendra Cook. Again, thank you for watching.